Today, I want to talk about contraceptive.
Let's have it.
Different methods of contraceptive. Whether you call it birth control, family planning, or even freedom tablet, you want to be free. We're all talking about the same thing. There are several contraceptive methods. Firstly, we have the hormonal method. Now, all these kinds of contraceptive methods, what they do is that they play around with your hormone. They reduce some, they increase some, and eventually you're unable to ovulate. If you do not ovulate, there will be no egg for the sperm to fertilize. Okay? The problem with these types of contraceptive is that sometimes you will have nausea, irregular bleeding, some other times sore or painful breasts. But just know this, that all hormonal methods will not protect you from STIs or STDs. So examples of hormonal methods are contraceptive patches, the one that they put on the shoulders and the one that they put on the thigh. Another type is injection that they give to you that stay in your body for up to 3 months. That one they also give you on your shoulder and also on your thigh, right? One thing about this injection is that it will take about 2 to 18 months for your ovulation to come back if you stop using this type of contraceptive. So if you are the kind of person who forgets to take your drug, then these kinds of ones I just explained, they are the ones for you. Another example of hormonal is vaginal ring. This one, they will wear it in the vagina and it releases the hormones little by little into the body. Secondly, another type of contraceptive method is barrier method. A good example is condom. This one will help both for family planning and also to prevent you from STD. So you can walk into any pharmacy and get the different types of condoms that are available. I know Black David will say, "Sir, what about withdrawal method? Is that one not still the best contraceptive method?"
See me see trouble, Lord.
Thank you, Black David. Yes, it is, but it's not usually very efficient. Now, if 10 persons use withdrawal method, 3 persons will get pregnant. That is about 30% failure rate, and it does not protect against sexually transmitted infections. By the way, if any of these contraceptive methods will not work for you, you can try the permanent method. That one, the woman will go to the doctor's office and they will use something to tie the fallopian tube, all right? And they will also seal the tubes that carry sperm, all right? So, but you have to think very well before you do all of that. Those are permanent methods. Now, before I go, I want to talk about another special class of contraception, which is called emergency contraceptive method. An example of this is postinol. Postinol is only for emergency. You can only use it when other contraceptive method fails. It's not something you rely on. It is taken within 72 hours of unprotected sex. So they prevent ovulation, that is the release of an egg during the monthly cycle. And the problem of this emergency contraceptive is that many persons misuse it. In fact, it is only needed to be taken once in a menstrual cycle. Now, using postinol indiscriminately can actually affect you and make you have several hormonal problems as a result of abuse of postinol. So please take note. Postinol is not a routine drug. It's supposed to be taken once in a month, once every menstrual cycle. A word they say is enough for the wise. Thank you for staying for this video. See you in my next video. Bye bye.